Hi, this is Callum. So this is a salivary gland. Salivary glands are probably relatively uncommon specimens you won't see very often. They do give rise to a quite vast variety of tumours of different cell types, or different appearances rather. That is again another specialised area of head and neck pathology, which most of us find very difficult. But this is a salivary gland. There are three types of salivary gland. There are the parotid gland, the sublingual gland, and the submandibular gland. And this is the submandibular gland. The salivary glands have a varying degree of mucinous and serous secretory proportions. If you were in the parotid gland, it would be mostly serous. If you were in the sublingual gland, it would be mostly mucinous. And in the submandibular gland here, it's seromucinous, so it's a mixture of both. So this is probably a good one to show you. This is how it looks. It's a mixture of a ductal system and ducts interspersed with glandular units that form into this kind of lobular structure, little lobules of which are collections of glands, with a bit of connective tissue and a rich vasculature and some fat. And that's salivary gland. So let's have a quick look in greater detail. So this is a good section. So this illustrates nicely all of the things that you can see in a salivary gland. So we've got a collection of mucinous glands here. I can tell because of their basally orientated nuclei and their abundant cytoplasm, apically orientated cytoplasm, that's quite clear and a bit bubbly. It's difficult, it's a wee bit blurry actually, this section. But here it's more nicely in focus. A bit bubbly. We've seen lots of mucinous glands at this stage, which can recognize mucinous glands. Pale, often light blue in hue, and that's a mucinous gland. Adjacent to that, we've got lots of a very different type of gland called these are the serous glands, which have got bigger nuclei, and again abundant cytoplasm, but it's very granular, taking up a lot of eosin pigment, giving it a pinkish, but also a purplish appearance. Very granular, and these are the zymogen granules, and they contain enzymes and so on and so forth. So that's the serous component, that's the mucinous component, and there are also ducts. Let's see if we can find one that's actually in focus. There's one. I think they sometimes call these striated ducts because of the kind of linear look or striated look that they can sometimes have. I don't know if that comes out, how well that comes across. But this is how the ducts look: round nuclei, abundant pink cytoplasm, tall columnar cells, and these are the ducts, striated ducts. You can also get what do you call it? Intercalated ducts that are between the striated ducts and the glandular units, but I can't see any of them here. I'm probably not very good at identifying them, even if I saw them anyway. So there we are. There we have it. Salivary gland. It doesn't take very long to go through the histology of a salivary gland, but it's a fantastically complex area in sometimes, and it gives rise to a diverse range of tumors. So you'll come across them later in your training, most likely, but it's useful to have seen a normal salivary gland to start you off. Okay, speak to you soon.